Hello, I'm Dr. Earl Campazzi. You may have heard that there's a virus circulating that could kill tens of thousands of people in the United States. And you're right, it's the influenza virus, not the coronavirus. However, I'm sure the coronavirus is on your mind, so I'm going to tell you a bit about it. The coronavirus is simply a common cold virus. That and the rhinovirus have been affecting us for ages. But this coronavirus has mutated, and it's mutated in two kind of scary ways. One, it has become much more easy to catch, much more infectious. And two, it is leading to a pneumonia that is potentially deadly. In fact, many people in China are dying from it. Unfortunately, I think the coronavirus is going to spread in, at least in a meaningful way in the United States for three reasons. First, there's so much travel in today's modern world. Secondly, and this is probably the most important reason, people are infectious. That is, they can spread the virus before they have symptoms. And of course, they don't know they have it, and the person who's close to them doesn't know they have it. And then lastly, this virus is just so contagious. Most viruses, one person infects one other, maybe two other at the most. This virus, one person with it is infecting 3 and 4 people, which makes the spread so fast. The way you should protect yourself, first and foremost, is by not panicking. Secondly, watch the news, listen for the words local transmission. Until you hear there's local transmission in your city or your county, you really have nothing to worry about. Once you hear those words, local transmission, go to the CDC site, because that is very good information. But basically, you're going to want to do some form of social isolation. Try not to shake hands with people. If you have to shake hands, wash your hands right away. Try to stay at least 5 feet away from people, further if you can. Most of this virus is spread through the air, but it can be spread through surfaces like a grocery cart. Use those wipes, disinfect doorknobs, phones, those kinds of things, anything that you're sharing with somebody else. The data really isn't in on this, but there is research that shows coronaviruses survive longer in refrigerated temperatures. So it only makes sense that the warmer it is, the less infectious it can be. I'm waiting for some research to come out, but I certainly would err towards having offices being a little bit warmer than usual. One concern a lot of people have is about public transportation, and it goes back to the first couple of points I said. First, don't panic, and second of all, listen to the words local transmission. If there's no local transmission, you're okay. If there is local transmission, then the CDC site recommends an N95 mask. Very simply, that's not a flimsy paper mask, it's more of a cardboard mask. And this virus can be spread through the eyeballs, as horrible as that sounds. So if you're having local transmission, having to use public transportation, then I would use tight-fitting goggles in addition to the mask. The good news about coronavirus is that our healthcare system is the best in the world. So if you would get sick, you have a tremendous safety net under you. What is happening in China won't happen here. We have more resources. We're lucky that way. Secondly, the medical technology is so far advanced. They've already sequenced the entire DNA sequence of this virus, and they're developing instant test kits, immunoglobulin therapy, and also vaccines. The vaccines will be developed probably within 3 months, but then, of course, ramping up to hundreds of millions of doses will take, I would say, close to a year. But the cavalry is coming, and this should not be something that scares you to death. It's just another virus. The influenza virus is already out there, and we're not freaked out about it, and you'll be fine.